Talking about antioxidants, guys, because Terrence, you mentioned antioxidants as well. I totally agree, especially AM application of antioxidants are such a foundational ingredient, just like we mentioned moisturizers and retinol. What ingredients and antioxidants, just to give those people out there some idea of what they should really look for in their ingredients for antioxidants? What are you highlighting, Terrence?
Yeah, I mean, there's more and more antioxidants being developed. I mean, I think where a lot of the data comes from is the classic vitamin C, vitamin E, ferulic acid. Those are kind of mainstay, kind of the OGs. There are also, newer products, bakuchiol. I always
Bakuchiol.
bakuchiol. I
Yeah,
always
I
butcher the
know it's a
name.
tough one.
Um, but you know, I often, when I'm looking at antioxidants, particularly for men, I'm looking at the science, but I'm also looking at the
Mhm.
formulation. Men are sometimes, clumsy. A lot of antioxidants or all of them are sensitive to sunlight. So they're, the way these products are packaged in often opaque bottles and often use drip or droppers. I find some men are a little resistant to that, and how I kind of incorporate men to use these products, because they're often, like you mentioned, Ted, used in the morning, is to pair it with something that most men, except myself, who do every morning, is shaving. So I say, look, those old school aftershave, like alcohol based products that burn your skin, throw those out. Here's your antioxidant. Pretend this is your aftershave, and pair it. Put it right next to your shaving cream, and you're going to be using this antioxidant. And there are some gel formulations that are really nice. And so I tend to gel non-alcohol, kind of like serum-based antioxidants that I think are nice for men, particularly post-shaving. And that shaving, actually shaving may enhance penetration of it, because you're almost, you are exfoliating, you're cutting the hair and mildly exfoliating the stratum corneum, so you're going to get enhanced penetration. So that's one kind of mental strategy I use, beyond going to their pocketbooks with kind of investing in the product, but also pairing it with a behavior they're doing every day to ensure compliance.
I love that. Dr. Hartman, do you use any other strategies?
That's my biggest one too, is to make it part
Yeah.
of something that they're doing every single day. And then also just talking to the patient and really getting a sense of how they have interacted with products in the past, what were their turnoffs, try to use those clues to select something that you have a good chance of them being satisfied with and compliant with.
I do something a little bit unorthodox, but I have them. I find a SPF that my male patients like, because a lot of male patients just complain so much about using sunscreen all the time. Actually, Hydro Boost has a great SPF sunscreen in that line, and I'll have them put a pea-sized or an English pea-sized amount of the sunscreen, and just add 2 or 3 drops of a antioxidant serum to that, mix it together, and apply all that together. I am sure I'm mitigating the effects of both the sunscreen and the antioxidant, but at least we're getting both on the skin, and I found that to be somewhat helpful. Makes me feel better, at least that I know they're using antioxidants and sunscreen in the morning, which we know are so important. As we move to nighttime, gentlemen, what kind of ingredients are you really focused on as we head into their nighttime routines? Terrence, if you want to get started with that.
Yeah, that's when I'm trying to incorporate the retinoid products.
Yeah.
And I often, we want to avoid irritation, so I often have them use it, every other night in the beginning, and pairing with often a HA based product like the Hydro Boost. And I start with that. I try to keep it simple. Two max. Maybe if they can tolerate the retinol, they're kind of oily and they're like they don't really need a moisturizer. Then sometimes some of these guys can fly with the just the retinoid at night. Uh, I pair that behavior with brushing your teeth. So I say my joke is the antioxidants are next to your shaving cream, and your retinoids next to your toothpaste, in your
Uh-huh.
cabinet. That way you don't remember. Those kind of get paired together, and then you can incorporate the sunscreen in the morning and the moisturizer as needed. So uh, that's kind of the basics, for all my patients. Now, we are often talking about how men are less likely to adopt complicated regimens. I do find the past 5 years, though, men are a little bit more, uh, uh, you know, accepting of skincare, asking more questions, and I think social media has played a big role in that. Particularly younger guys are trying to be more proactive, which is great, and our older men are needing a little bit more handholding. But I think that's why we're seeing the male skincare market kind of grow as it has.
What do you think about DNA repair? Is that something that you consider at night at all, or do you feel is the science there in your eyes, or do you not you're not ready to kind of recommend those products, Terrence?
DNA repair products,
Yeah, DNA repair enzymes and products. Yeah.
yeah, I mean, and there's there's the DNA repair, there's regenerative products, you can use the growth
Yeah.
factor serums, you have topical exosomes. I mean, there's a whole kind of rabbit hole.